Hi friends, welcome back. This is Kara with the People's Harm Reduction Alliance and co-founder of the Harm Reduction Doula Collective. And we're going to talk about harm reduction and pregnancy, or perinatal harm reduction. So harm reduction that coincides with any reproductive journey, whether that is a pregnancy that's released intentionally or unintentionally through miscarriage or abortion, or a pregnancy that goes all the way to term. So there isn't a huge difference between harm reduction for someone who is pregnant and someone who is not. We want folks who are pregnant to be using the same harm reduction practices and principles that we would use even if we weren't pregnant. So accessing sterile syringes, not reusing, doing test shots, disposing of those syringes safely. It could be smoking. So maybe you're wanting to move from injecting to smoking, or smoking is your primary practice for using drugs. So making sure that we have access to pipes, access to testing kits or clean foil, preferably pipes. Pipes are a little bit less harsh than smoking off of foil, but we understand that not everybody has access to that. We want to be looking to test our drugs as much as possible. If you don't have access to test strips or to a mass spectrometer, which I'll talk about in a minute, making sure that we're using smaller amounts if we're smoking, and doing a test first, making sure that we're not alone, or a test shot if you're injecting. Same with doing bumps or boofing if you are gumming your drugs or taking it orally. We always want to make sure that we're not using alone, and that we're letting somebody know what we're taking, where we are. If it's not possible to use with somebody, sometimes you're out, sometimes you're alone, sometimes you're in a bathroom somewhere, making sure that we're not keeping the door locked after we have used, or utilizing the Never Use Alone hotline. I'm going to drop the link to that below. If you don't know what the Never Use Alone hotline is, it's a peer run hotline where you can call in and let them know your location, what you're using, and they will stay on the phone with you during your use and for a period of time afterwards. And if you ever stop responding, then they will dispatch 911 to your location so that you can receive medical attention. Some considerations if you are injecting is just, where are you injecting? How is your vein care? So if you're experiencing like having a hard time hitting, what's your primary location of use? So when you're pregnant, your body's producing a lot of blood. Sometimes there's swelling, sometimes it can be harder to hit. We want to monitor for any sort of infections, because that can have an impact not only on your health, but on the health of babies. So having access to wound care, or seeking out access to wound care if you have something that's not healing, or you're seeing any signs of fever, swelling, skin discoloration, abscesses that aren't going away. We want to get that taken care of, because those infections, if they get serious, can really have an impact on not only your health, but baby's health. And both are equally as important. We also want to think about, are we rotating? If we're putting too much strain, especially on some of our main highways of circulation, that can increase like swelling and discomfort, especially in a pregnant body that's already experiencing a lot of stress and strain. The other thing that we want to just take note of is that your tolerance can change a lot during pregnancy. Your metabolism changes a lot during pregnancy, just like you might experience times where you're like a lot more hungry or a lot less hungry. You're feeling different effects of different things in your body. we want to monitor for those fluctuations, because sometimes your tolerance can go way up and sometimes your tolerance can go way down, or sometimes you just might be more prone to overdosing. And that's because your body is in a state of exhaustion. Pregnancy can be really triggering. It can cause a lot of stress on your nervous system. And when you are in places where you don't feel as safe, or in new and unfamiliar environments, or simply just that your body is responding differently to even the drugs that you've used for a long time, it can make you more prone to overdose. So this is where it gets extra important to have people around you that you trust, have a safety plan, have Narcan on hand, preferably multiple doses, so that in the event that something happens, you are around people that are going to keep you safe, that you are safe. And we're also thinking about how are we tapering? I know that for a lot of folks, when they find out they're pregnant, especially if they intend to carry a pregnancy to term, most of the folks that I've worked with have tried to taper their use. And that can be really difficult. And sometimes it's intentional, sometimes it's not. But if you are having trouble accessing a supply, or you are trying to taper your use, especially with fentanyl, that can be really difficult just given the strength. So we want to be being extra careful about who we're around, especially if we're trying to lower our dose. We're maybe dropping our tolerance, or we're experiencing some withdrawal symptoms, and then we come back in and you might get a hot spot, or you might just get something that you don't usually use from a dealer that you're not as familiar with. So the drugs themselves can change too. And I know that you all know this. If you're a person who uses drugs, this is probably something that you're very well aware of. So for folks who are watching this video and they're looking to support people who use drugs, these are some considerations that we have. Like, if a pregnant person is using and is going through an unintentional period of withdrawal, it might be harder to access drugs while you're pregnant. And then they come back in and they use the same amount, or they use from a supplier that they aren't familiar with, then that can really increase their risk of overdose. So making sure that folks, if you're supporting somebody who's pregnant and using drugs, or if you're supporting somebody who's postpartum, either after miscarriage, loss, abortion, or birth, who is using drugs, tolerance can change a lot while our bodies are in flux and going through a lot of their own changes, and so can our access to who we are getting our drugs from. So having those trusted people that you can call up, that you can be around, that you can even just be on the phone with if they're not able to be there physically in person, so that they can keep an ear on you if they can't keep eyes on you. If you are supporting somebody who is pregnant and using drugs, or postpartum and using drugs, are you helping them get supplies? Are you bringing them clean rigs? Are you taking their used ones away? Are you helping get them to an exchange, or supplying them with pipes? I really want to reduce the stigma around this, because again, it is more dangerous to overdose during pregnancy, or to go into heavy withdrawals during pregnancy, because of the risk of preterm birth. Lack of oxygen to the brain, to baby, disruptions in your heartbeat, and the stress and strain on your body are a lot, even when you are not pregnant. And with a pregnant body that is or a postpartum body that's already going through a lot, this can really tip it over the edge. So we want to make sure that you are cared for, and we would much rather have you using with somebody else and using alone, because of the fear, shame, stigma, or secrecy. This is not to say that those feelings aren't entirely fair and valid. there is a lot of stigma around pregnancy and substance use, and that's why I'm so glad that you are all here and that we're talking about it in an open space, because it isn't talked about enough, and it's very, very common, and we don't want people to feel alone in it. Pregnancy is already isolating enough, so being pregnant and using drugs can be a really, really challenging experience if you don't have people that you can lean on and talk to, and information that you can gather. We've talked about in another video access to treatment options and what those can look like. I won't go over that too much here. I just wanted to provide a little bit of an overview, and hopefully we can meet in person, or you can hit my contact. You can drop questions, comments, concerns in the comment section below. Hit us up on Instagram if you're in the greater Duwamish area of Seattle, King County. Please reach out to People's Harm Reduction Alliance. You can ask for care if you have more specific questions, or you can visit a brick and mortar site or one of our outreach vans. We have a mass spectrometer at our university district location, which can test down to what makes up 5% of your drugs. So it will tell you everything that is in it, down to what makes up 5%. This is an amazing tool because we're not always just concerned about whether or not someone intends to use fentanyl or not, or maybe how strong that is. That can be a concern, but sometimes things show up in a drug supply, like xylazine, that can really impact the ability for wounds to heal and circulation. It can increase the severity and risk of infections. So there are sometimes drugs that show up that are cut into our street drugs that are of concern during pregnancy, and can be what we call contraindicated. If we're trying to track whether or not fentanyl is present in your drug supply, maybe you aren't a regular fentanyl user or you don't have a tolerance to it, then fentanyl test strips are a really powerful tool to test and make sure that you aren't getting any sort of contamination of fentanyl. So they will test down, the strongest fentanyl test strips can test down to 5 nanograms of fentanyl in a sample from the residue of a baggie or a cooker when diluted with the appropriate amount of water. Also, my apologies if you can hear my dog in the background whining. He's our little harm reduction doggo, and he's hearing some noises outside. So I hope that this was helpful. As always, hit me up, drop your comments, drop your strategies. This is not an exhaustive list, and we will hopefully see each other soon. Thanks. Bye.